Dr. Carter here again to tell you about the bone of the arm, the humerus. The humerus has two major sites of attachment with other bones. Superiorly, here we have the glenohumeral joint, where it attaches to the scapula. And down here we have the elbow joint, where it attaches to the radius and ulna. Let's start by examining the proximal end. On the top here, you see this rounded surface. This is the head of the humerus, and this is actually what articulates into the glenoid cavity that we saw on the scapula. Just beneath this, we have the anatomical neck, and this is this inscribed area here, just deep to the head. This is where the glenohumeral joint capsule actually attaches. Now, distal to that, we have the surgical neck. And it's called that because it's actually a very common site of fracture in the arm. It's this narrow portion. In this area right here, we also have the greater and lesser tubercles. Here we have the greater tubercle and the lesser tubercle. And between them runs the intertubercular sulcus. The tubercles are the attachment site for many of the scapulohumeral muscles. But sometimes it's not all about attachment. In the intertubercular sulcus here, which is that sort of groove that runs in between the two tubercles, is actually a protected passageway during life for the tendon of the long head of the biceps. The shaft of the humerus has this unusual structure here. The deltoid tuberosity. It's a little difficult to see, so we've started with our surfaces on. It's actually a roughened and raised area where the deltoid muscle attaches, right here. As we travel more distally, we come across many of the parts that you would think of as the elbow, particularly the medial and lateral epicondyles. The medial epicondyle is the largest of the epicondyles, and this can actually be palpated or felt on yourself closest to the body. That's this one right here. The lateral epicondyle, as you can see, is much smaller. At the very distal portion of the humerus, we have the condyle, and this contains two articular surfaces. And these are really important because they're what allow your elbow to function the way it does. As I said, they had two articular surfaces. First of all, there's this sort of rounded shape here known as the capitulum, and this cylindrical wavy area, the trochlea. The capitulum is the site of articulation for the head of the radius, while the trochlea is the site of articulation for the ulna. Speaking of the ulna, because of the bent hook of the ulna, which we'll speak more on in the next recording, the humerus has to have two hollows or fossae into which the processes of the ulna can move or retract out of as the arm moves. So posteriorly we have the olecranon fossa, and on the anterior surface we have the coronoid fossa. And those are the major structures of the humerus. Thank you.